I think as a child I've always sort of had an interest in health. I did always remember having a little nurse's outfit and case when I was a child. Speech and language therapy is really important. People who have had speech problems, language problems, communication problems will tell you that is the quality of life. Somebody's voice is their identity. Somebody's speech and language enables them to interact, communicate with others. If you haven't got that, you haven't got your social life, your social experience, even affects your role as a person. It's so important. What was most rewarding was when I finally got out on placement. It was really what I wanted to do. I loved the uni, I loved studying, but actually out there doing the job, actually being with children at the time when I was first on placement and then later with adults, that was what I really loved. I think when I graduated, initially I felt really nervous about looking for a job. We'd had really good advice from the uni and the careers department at BCU. So I set out with my job applications and amazingly, the first job I applied for I got, and that was working in a team in the community working with adults with learning disabilities. After I finished working with adults with learning disabilities, that was only a temporary contract, so I was lucky enough to secure a permanent job straight away in my dream job, which is where I am now, and I work in a hospital with adults with acquired communication difficulties. So again, that can be speech difficulties, swallowing, or language problems following a stroke. I've also managed to continue my ongoing learning, attending special interest groups. These are groups set up by our professional body, the Royal College of Speech and Language Therapy, and they're in different areas and cover different parts of speech and language therapy, such as voice or swallowing, where clinicians with that special interest get together and share information, case studies, we have teaching sessions, and it's a real chance to learn and to improve your own skills and for your own continuing professional development. I feel it's really important for students to have a positive placement experience. I did as a student. I worked with some great clinicians, and that's where you really learn. Uni's great, the lectures are great, you learn such a lot, but it's not the same as actually being out there, seeing what the job's like, working with clients, relatives, carers, other professionals. It really gives you that taste of what the job's all about and helps you learn those core skills as well, really.